Bismillahirrahmanirrahim. Assalamu alaikum. Welcome everybody to online teaching program. Today my topics about the most important organ in a human body, liver. Why my topics is liver? Because liver, there is a lot of clinical problem which are associated with liver. Now let me introduce myself. I am Professor Dr. Mahmuda Begum, Professor and Head, Department of Anatomy at the Newszonebd Medical College. This figure, there presents the healthy liver which appears shiny and smooth surface. So this is the gross anatomy. This gross anatomy can distort it, different type of the clinical problems, like there is a cirrhosis of liver, it is also known as the carcinoma of the liver. The surface is irregular, size is, volume is decreased, and this figure is inflammatory in condition. It is known as the hepatitis. There is also distortion there, micro anatomy and also the macro anatomy. These fatty liver, where the growth of the fat cells in the liver. In these conditions, the liver size is enlarged and also their appearance and the textures both are distorted. And below there is another complications, the parenchyma of the liver, local formation of the abscess, the parasitic disease, it is the liver abscess. So all of the feature, all of the clinical conditions, there is a both macro and microscopic distortion is focused. So, and liver anatomy is necessary, thoroughly known about the liver anatomy is necessary to correlate the different clinical conditions. For this reason, I would like to let you know about the problem-based liver anatomy. Before I start my main topics, I also like let you know about the anatomy of any organ. When we discuss it, we must memorize the different division of the anatomy, like the macroanatomy, that is the gross anatomy, that is the structure or the microstructure of this organ, that is the microanatomy, and also the developmental source or how the organ is developed, that is developmental anatomy, and how the organ or these different clinical condition is diagnosed. There is some imaging anatomy, and last of all the applied anatomy. This we first focus about the different applied anatomy of the liver. Let us start the gross anatomy. So what is a liver? Liver is a largest interperitoneal organ, and also it is a mixed or glandular organ in human body. Why it is called mixed? Because we know which are the exocrine part, they have the duct and their secretion should transport through the duct. So bile production of the liver and it transport through the bile duct, it is the exocrine part of the liver. And those are the endocrine part. We know the endocrine part, their secretion can transport it through the blood and to the target organs. So liver can also produce the different proteins and protein factors. It is your endocrine functions. So liver, now the livers, it has a some measurement. Weight of the liver. Weight of the liver, it is very important. Can different disease, this weight also either decrease or increase. So normal liver weight should know. This weight is varying according to the age and sex. In adult, weight of the liver about 1/5 of its individual body weight, and in case of the children 1/20 of their body weights. And in case of the sex variation, in case of the male, the weight about 600 gram, and in case of the female, it is about 1300 gram. So weight of the liver, normal weight of the liver, average 15 centimeter, and color throughout the life, it is the reddish brown in color. And texture of the liver, that is the parenchyma, consistency of the parenchyma, it is the soft to firm. Now the function of the liver. Liver perform a wide range of metabolic activities required for hemostasis, nutrition and immune defense, and it is important for removal and also breakdown of the toxic and partially toxic materials from the blood. For the liver also regulate the blood sugar and lipids, and also storage certain vitamins, iron and other micronutrients. Liver also synthesis we mentioned already, that is synthesis of the protein and clotting factors, and also last and most important function, production of the bile. Now, where the liver is present in the abdominal cavity, that is location. Liver occupies the right hypochondrium, epigastric, and also it extends to the left hypochondriac regions. The figure that's showing the abdominal cavity, it has a 9 region, upper 3 region, right hypochondrium, epigastric and left hypochondrium. At the medial to the left midclavicular line, liver is extended. Now the surface anatomy. Greater part of the liver is situated under cover of the right costal margin, and the diaphragm separates the liver from the lungs, pleura, pericardium and also heart. What are the features of the liver? The feature of the liver for descriptive purpose divided into two. Some are the general feature and some are the specific or special feature. So, general feature has the surface of the liver, there is a border of the liver and the lobes. These are the general feature. And what are the special feature? There's a gateway of the liver. This is the protohepatis. It is the gateway of the liver, and there is a fissure for the ligamentum venosum, fissure for the ligamentum teres, and also there is a fossa for the gallbladder and groove for the inferior vena cava. Now the surface, there are some relation and impression present. So surface of the liver and their impression and relations. The figure, this is the left side, on the right side and the inferior surface. This is the inferior surface. It is identified by the presence of the gallbladder, because they are present the fossa for the gallbladder. And these are the three surfaces. This inferior surface is also known as the visceral surface, because there are lot of the viscera are related there and also their impression present there. And these are the superior surface, the right lateral surface and anterior surface. This surface is covered by the diaphragm. So included these three surfaces is also known as the diaphragmatic surface, and this is the posterior surface. Posterior surface is also identified that present the inferior vena cava, that is groove for the inferior vena cava. Now relation of this surface, but that is what are the structure is surrounded the liver. The figure showing from the left to right, this is the esophagus, stomach, pyloric part of this stomach, duodenum, right colic flexure, suprarenal gland, kidney. They are all surrounded. These are region of the inferior surface mainly, and inferior vena cava, these are present in the posterior surface. So now visceral surface, there is an impression and also relation of the organs. Now from the left to right, there is a visceral surface. First is the impression of the esophagus, then the gastric impression, and there is a pyloric part of the stomach, the pyloric impression, and there is a gallbladder. The right side, there is a duodenal impression, and on the right side from downwards to above, there is a right colic flexure, right renal, and close to the inferior vena cava, there is a suprarenal gland. So these are the relation on the visceral surface or inferior surface. Now the posterior surface. Posterior surface, the important identification point that is present is the inferior vena cava and also the groove for the inferior vena cava. And lower part of the posterior surface that present the protohepatis, that is the main gateway of the liver. And also there present the fissure for the ligamentum venosum and lesser omentum. This is the protohepatis. Along the protohepatis there present the another peritoneal reflection is the lesser omentum. And also close to the fissure for the ligamentum venosum there present the tubal omenta. Now superior surface. Superior surface, the main focus is that there present the concavity of the superior surface, there present cardiac regions. That means the superior surface impression like this convex and then concave and again the convex. This surface is the superior surface and also they are related with the lungs, pleura, pericardium and also heart. And this is the right lateral surface. The right lateral surface is more clinically important region because this region is chosen for the needle biopsy of the liver. For this reason, this right lateral surface is divided into 3 zones: upper, middle and lower zone. The upper zone which is extend up to the 8 ribs and it is related to the direct to the lungs and the pleura. And middle zone, there is only the pleura, it is known as the postdiaphragmatic recess and it extend up to the 10 ribs. And this is the lower zone, there the diaphragm is direct contact with the ribs. This region, this intercostal space is chosen for the needle biopsy. Now the anterior surface. Anterior surface, which is completely covered by the right and left costal margin and the xiphoid process, diaphragm, and also related with the lungs, pleura, pericardium and also anterior abdominal wall in the subcostal angle. Now what are the lobes present of the liver? Gross anatomically, liver can be divided on the basis of their external appearance like right and left lobe, caudate and caudate lobe, which are in part defined by the peritoneal ligamentous attachment. Now right lobe. Right lobe is the largest volume and contributes to all surface of the liver, and it is divided from the left lobe by the presence of the attachment of the falciform ligament anteriorly and superiorly, and on the posterior inferiorly it is separated by the fissure for the ligamentum venosum and fissure for the ligamentum teres hepatis. And this surface is included caudate and caudate lobe. This lobe, right lobe, it is not functional, it is only the anatomically. Now the left lobe is a lesser volume and it lies on the left of the falciform ligament and it is not subdivided and it is substantially thinner and than the right lobe, and it having a thin apex that pointed to the left upper quadrant of the abdomen. Now the caudate lobe. Caudate lobe which present in the posterior surface and above the protohepatis, and on its right side there present the groove for the inferior vena cava and it is continuous above with the superior surface. This caudate lobe is functionally is a individual lobe, but it is anatomically it is related with the right lobe of the liver. Now the caudate lobe. Caudate lobe it lies anterior to the protohepatis. So it is bounded on the right side by the fossa for the gallbladder, on the left side by the fissure for the ligamentum teres hepatis, and anteriorly the inferior border and posteriorly the protohepatis. This all lobe also functionally is separated, but anatomically it also associated with right lobe. Now the most important and specific or special feature is the protohepatis. It is the gateway of the liver. This is present in between the caudate and caudate lobe, and this is the transverse fissure. Through this fissure, structure exit and entrance the liver. This figure showing the relation, what are the structure present in the protohepatis. Anteriorly, there are present the right and left hepatic duct, and in middle there is present the right and left hepatic artery, and posteriorly right and left portal vein. Now, what are the support of the liver? Liver can maintain its position in the upper quadrant of the abdomen by both the dynamic and static factors. Factors can categorize into three. The primary factors, that is the suspensory attachment at the posterior abdominal wall to the inferior vena cava, hepatic vein, coronary ligament, triangular ligament. These are the primary category factors. Now, the secondary, the right kidney, right colic flexure, duodenopancreatic complex, they form the secondary factor. And the third or tertiary factor, which is when the attachment of the liver to the anterior abdominal wall and the diaphragm by the falciform ligament. So, these different factors which are important surgically due to the understanding the pathophysiology of the blunt trauma of the liver, and also their support the transplanted liver graft. So, liver, the inferior vena cava and hepatic vein, which is support the main bulk of the liver, but intra-abdominal pressure and others factor, they are the accessory supports of the liver. So, there is some peritoneal attachment and the ligaments of the liver. Liver is attached to the anterior abdominal wall, diaphragm and other organs by different peritoneal ligament. Like this, from the anterior abdominal wall, this is the ligament, twofold of the peritoneal ligament, the falciform ligament, which are attached the anterior surface and goes upwards. In the superior surface, they can diverge, and on the right side, it is continuous with the superior coronary ligament, and on the left side it is continuous with the anterior left triangular ligament. And the posterior inferior surface, this inferior coronary ligament and that is superior and inferior coronary ligament, they can fused on the right lateral part and form the right triangular ligament. And inferior coronary ligament, they can goes the group below the group of the inferior vena cava, and then it is continuous with the layer of the lesser omentum at the porta hepatis. And on the left side, there is a left coronary ligament, the anterior and posterior coronary ligament, they can continuous with also the layer of the lesser omentum. These enclose the porta hepatis. So, now I would like to show the torso and showing the different relation and also the liver and abdominal cavity.